Steroids for rheumatoid arthritis. Are they a miracle drug or a long-term risk? If you have RA, you've probably heard of steroids like prednisone. They can reduce pain and inflammation fast, but at what cost? Let's break it all down. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Rheumatoid arthritis, or RA, is an autoimmune condition that causes joint inflammation, pain, and stiffness. Many doctors prescribe steroids like prednisone or cortisone injections to help manage symptoms. And while these medications can provide rapid relief, they also come with risks. So, should you use steroids for RA? And if so, how can you do it safely? Let's dive in. So, how do steroids work in RA? Steroids or corticosteroids are powerful anti-inflammatory medications. They work by suppressing the immune system and reducing inflammation in the joints. This can quickly improve pain and swelling. The key benefits of steroids for RA include fast relief from pain and stiffness. It helps to control severe RA flares, and it can prevent joint damage in the short term. However, an analogy would be to think of steroids like firefighters putting out a fire in your joints. They work quickly, but if you rely on them too often, they can eventually weaken the structure of the building, in other words, your body. Steroids can be effective, but the key is in how long you use them. Short-term use, meaning a few weeks or less, you can help to control severe RA flares, reducing inflammation quickly, and allowing time for long-term RA medications or disease-modifying treatments to take effect. Long-term use, meaning months or years, unfortunately, you get an increased risk of serious side effects. It can weaken your bones, causing osteoporosis. It can raise your blood sugar, causing a risk of diabetes. It can cause weight gain and high blood pressure, and it can suppress the immune system and lead to more infections. So what should the goal be here? If you need to use steroids for your RA, use the lowest dose for the shortest time possible. There are some common myths about steroids and RA. Myth number one, steroids are the best treatment for RA. The reality is that steroids only reduce symptoms. They don't stop RA from progressing long term. The best long-term treatments are disease-modifying drugs, or DMARDs, like methotrexate or biologic treatments. Myth number two, if I feel better on steroids, I can stay on them long term. The reality is that long-term steroid use leads to serious side effects. It's important to taper off and use other RA treatments. Myth number three, steroid injections are safer than pills. The reality is that steroid injections can be useful, but should not be overused. Too many injections can weaken joints and cause damage. So steroids can be helpful, but they should be used wisely. Here's when they might make sense. During a severe flare-up of your RA. If your rheumatoid arthritis symptoms suddenly worsen severely and short-term steroids can provide relief. You can also use them while waiting for long-term treatment to work. Disease-modifying treatments can take weeks to a couple of months to start working. Steroids can help bridge the gap. And as a last resort for severe cases, if other treatments fail or there's contraindications from utilizing some of these other treatments, steroids may be an option, but only with close monitoring with your rheumatologist. There are cases where steroids are needed, but your rheumatologist should understand that if you need steroids, you're also considering an adjustment to your long-term treatment regimen. There are better options for long-term RA treatment. Disease-modifying treatments, or DMARDs, like methotrexate, are the first-line treatment. Biologic treatments have been our treatment focus for the last 30 years as well. For milder symptoms, using lifestyle changes such as nutrition, exercise, and stress management can also be beneficial. So if you're on steroids long-term, how can you safely reduce or stop steroids? Stopping steroids suddenly can cause withdrawal symptoms. Here's the right way to taper off. To begin with, work with your rheumatologist to lower the dose gradually. Number two, you want to consider switching to other RA treatments to control the inflammation longer term and in a more safe manner. Number 3, you want to eat a healthy diet to support bone and immune health. You also want to exercise to prevent muscle and bone loss. Here's a pro tip. If you've been on steroids for a long time, tapering off should be done slowly to prevent withdrawal symptoms like fatigue and joint pain. Long-term steroids suppress your adrenal glands' normal function. So suddenly stopping without giving your adrenals a chance to recover can be dangerous. Key takeaways here: steroids can help RA symptoms short-term, but they are not a long-term solution. Long-term steroid use has serious side effects, including bone loss and immune suppression. The best RA treatment is a combination of disease-modifying treatments, lifestyle changes, and targeted therapies. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and living healthy. Until next time, have a good day and live well.